Hello everyone. Today, we are examining a classic case of an advanced hiatal hernia, focusing on its detailed radiological anatomy. Starting with the PA chest radiograph, we observe a large opacity superimposed on the cardiac silhouette. However, the left heart border remains sharply defined, meaning the silhouette sign is negative. This preservation of the cardiac border confirms that the lesion is located posteriorly within the posterior mediastinum. The presence of a prominent air fluid level in this region, which distorts the paraspinal lines, points us directly toward a hiatal hernia, rather than parenchymal pathologies like lung abscesses. To confirm our diagnosis, we move to the coronal CT reformats. Here we clearly see the herniation of the gastric fundus and body, through the esophageal hiatus into the posterior mediastinum. In this plane, the intrathoracic localization of the stomach and its anatomical relationship with the surrounding vascular structures are fully visualized. Finally, focusing on the axial sections at the level of the hiatus, we observe that the distance between the diaphragmatic crura, the dehiscence, significantly exceeds the pathological threshold of 15 millimeters. This objective measurement of crural insufficiency confirms the fundamental anatomical defect, leading to the gastric mediastinal migration.